Traditionally, medical schools in the UK have been using the panel interviews, which is where the candidate goes in. You have a panel of people who are experts plus a layperson, sometimes a student. So those 3 or 4 people at maximum would be asking you questions, sometimes around your personal statement, sometimes out with your personal statement. And it was felt that a lot of times it didn't really come across all the different abilities that you can actually have. So what has been done more recently is a move from the panel interviews over to what we call multiple mini interviews, which is the MMI lettering that everyone's sort of talking about these days. Now basically what happens with the MMIs is that you have a number of stations. Normally you have any number between 7 to 10. So you have different stations which are going to test different aspects of you. So one might test communication skills, another one might test empathy, another one might test teamwork, another one might test your realization that you do have limitations and that you should call for help where necessary. And some of these stations can just be a one-to-one. Some of them can have an actor who facilitates the whole thing. Sometimes you just read a scenario and you talk around the scenario. So different aspects of different abilities can be discussed. So that's basically what MMIs are. And then you're assessed per station. At the end of that round of covering all the stations, all your marks are added up. And it's meant to be more fair because 10 different people assess you. Therefore, the mark that goes into the total assessment of you as a candidate is a mark that comes from different people judging you. So we feel that it's a much fairer way. And in fact, most of the medical schools now are moving towards that. We at Aston Medical School, we're very proud of our ethos and how we work and how we select our students, because we want to widen participation as much as possible, not only within the students in the UK, but widen participation to the international community. And we want to access students who actually we feel have the right qualities to be absolutely the best doctors that there ever can be. And they go out into the world and do good. So our selection process, we've really concentrated very hard on how do we choose these qualities that we're going to test in our candidates. So we've really, we've gone out to lots of doctors, lots of nurses, lots of healthcare workers, students, patients, and we've got their input into coming up with a set of criteria that we think are really important in a person who will be a doctor one day. And these qualities actually map to a very large extent to the General Medical Council's qualities of a doctor who's registered with them. These qualities include things like, again, communication skills, teamwork, being able to lead, being able to follow, because often we think, oh, doctors, you know, we're all going to do what you tell us to do. But often doctors have to listen. They have to be the follower. They can be given instructions by a physiotherapist who says, you know, this is the best thing for your patient. And the doctor's got to understand that different people have different abilities. And they've all got to come together and look after the patient. So the doctor has to have this sense that the patient is their primary concern. And everything, the whole world revolves around providing the best care for that patient. And if we can instill that quality in our doctors, I think we will succeed in sending them out there and making them do what is best for the patient. When we organise our multiple mini interviews, MMIs, we're going to have them here on site, and all the students, including our international applicants, will be required to come to Aston University to take these MMIs. Now, why that is that it's really important that the students see us, see where we are. You know, we're talking about this wonderful place that we'd like them to come to. So it'll give them a sort of view of everything that we've been talking about. give them a chance to talk to us, the staff at Aston Medical School, and also give them a chance to have a look around at the city, at the university, at the facilities we offer, and also for us to assess them on the home ground, so to speak, so that the place where they're going to come to. So the MMIs are all going to take place at Aston University. In formulating our MMIs, we have taken into account the sort of applicants that apply to medical school, and we feel it's really important that the questions that are set and the scenarios that are set within these stations are actually relevant to the person and the age at which they're coming to us. So we're not going to ask any very detailed medical question in any of these MMI stations. They're going to be relevant to the age and the ability of the person at that stage. So our MMIs, the kind of things we're looking for in our MMIs are actually the qualities I was talking about earlier. So the stations select for qualities such as perhaps communication skills, showing empathy, teamwork, being able to lead as well as follow, knowing your limitations, because again that's a very important aspect of a doctor. Realizing that when you're talking to patients or when you're dealing with them, maintaining their dignity is a really important aspect of it. So all of those things are things that we will be testing in these stations, plus other aspects that I haven't listed. The other thing with MMIs is that it's actually a very good interview process, because if, for example, you panic in a station and you feel you haven't done as well in that one, you can actually pick up your marks. So you can say, well, that didn't go so well, but you can really do very well in the next one. And at the end of the day, as I explained, we tot up the marks from each of the stations, so you can actually do badly on one, pick up on another, and still score very well. So it doesn't have a sort of disaster aspect. You can actually come up and achieve to your own expectations.